Across the last 3 years, Centria has been on a mission to fundamentally transform the model of care for our clients, our staff, and the industry.
We will share with you our journey towards assent-based care, the lessons we've learned, and the people we've learned them with.
We're your hosts, Timothy Yeager
and Hillary Laney.
Welcome to the HRE Podcast.
Welcome. Thank you. One, I'm just happy you're here, and two, I love to spend time with you. So both things are exciting because we get to have a really cool conversation, but also quality time with you is really reinforcing for me.
Oh, awesome. I'm excited.
Yeah, so I'm going to let Timothy kind of set us up for the conversation.
Yeah, so season 1 of the HRE Podcast was all about like our client care, client-facing work, and our views on the assent-based model of care. Season 2 that we're talking about is how do we support staff
or families
Sure.
To support both themselves, but also the children they work with or the children they have. And what are the conditions in which we helps create an optimal environment for that to happen?
Awesome.
Yeah, I think it's I'm excited about this season because I think it's a conversation that the assent-based world isn't having yet. Like, we're so focused on the client, and that's great. I'm also very focused on the client. But I think in the last year or so, one of the things I've appreciated that you've started to transition our language into and challenged me in particular to think about is how do we support the people who are supporting the kids? Because you can't help a child regulate if you're not regulated.
Love that.
And so we wanted to talk to you about that today.
Awesome.
Before we get started though, I think it's important, you're a unique guest for us in many ways. And I want to give you the opportunity to share like what your background is, what you do now, and like how you think some of what you do integrates into that.
Sure. Yeah. Okay. I wear many hats. So I'll start with what I'm doing now and then talk about how I got there a little bit. So right now I'm working for the University of Washington Autism Center. Yes, very proud.
Did you wear purple on purpose?
Yes.
Okay.
Did you really?
Yes.
I love that. I should have done
It's my alma mater if anyone didn't know.
Yeah.
And how we met, I think, kind of. So I'm working at the Autism Center, building an interdisciplinary feeding clinic, doing some clinical supervision, and then directing our consultation and training program. I have been an educator of master's students in ABA. I've done research in mealtime and feeding support and ABA, and work in ABA reform. And I think my most important hat that I wear is I'm a parent of 3, including my oldest diagnosed with autism, and and she's given me permission to talk about her just to say. And so I've encountered a lot of the challenges with like feeding and mealtime and others that I talk about. So that's really informed kind of my perspective and made me realize my mistakes before playing mom.
One thing we didn't talk about on season 1 that I'd like to try to integrate is like assent-based feeding.
Yeah.
Because I think that's something there's not many people doing that right now. No. And it's really sad, one. But also like in many ways, it's also exciting to be a pioneer in our field. I think often about my choice to like jump into like practical functional assessment and skill-based treatment. And I've been saying this a lot this weekend, but like you don't know like the good old days or the opportunities and what they're gonna do for you until you're looking back. And I do feel that in the world of practical functional assessment and skill-based treatment and assent, like I get to be a part of somewhat of a pioneering group. And I find that it's like such a privilege and something I value so highly. And we're just starting to get people branching into the feeding components of assent-based care. And so you're a pioneer in that. And I think that's really cool.
Thanks for saying that. I'm sad. I think I agree with you that I'm sad, like kind of sad to be a pioneer. I'm glad that we're talking about it, but I'm sad that it's taken so long.
Yeah. And you also get to be a part of something really big and shifting for the field, which is bittersweet in many ways.
Totally.
But I just would love for you to give your spiel around like your model of feeding intervention that maybe people aren't familiar with because most of our feeding literature is based in an extinction model.
Yeah. Can I tell kind of like a longer story?
Please, give a spiel, however long your spiel is.
I just talked about this in my talk
right
here
now.
at APBA, too. But So it starts with Lucky Charms. Actually, it starts before that. And I will come back to Lucky Charms.
I love the Lucky Charms.
Have you heard that story before?
Yes.
Okay. So I was like a brand new behavior technician before there were behavior technicians, and I was working with in homes of kids with autism, and almost every, if not every, family said, "Can you please support us with feeding?" And I realized I didn't know anything about it, and so I started going to like these big conferences, like the one we're at now, and going to all the feeding talks. And they presented this amazing data, right? They showed videos and baseline data of kids who were refusing food, who were crying, who were struggling. And then after a feeding intervention, they had these beautiful graphs of like food acceptance. And so I'll talk a lot about mistakes I've made along the way. So back then I was like, oh, this is beautiful, I could do this. I went back and I started implementing some of these things, differential reinforcement to reinforce acceptance, some elements of extinction, and I didn't feel good about it. It didn't feel meaningful. Sometimes the kids were eating more, but I didn't like how we were getting there. Their families didn't want to implement it. The kids didn't want to do it. I was like, oh, this isn't quite it. So when I went to the University of Washington, I told my advisor that I wanted to learn more, and she sent me to a state-of-the-art clinical program, and in a hospital-based program. And it was multidisciplinary, so I learned so much from like registered dietitians and speech language pathologists and medical providers, et cetera. And this kid came in who was about 9 or 10, and by the time he got to this clinic, he was eating Lucky Charms marshmallows, drinking milk, and probably eating like a cracker of some sort. And so his family was, of course, desperate. They were like bulk buying Lucky Charms marshmallows.
Picking out the marshmallows.
You could actually bulk buy them now, but it's not cheap.
Don't tell my kids.
It's not cheap. And they presented a slice of carrot to this kid, which back then is like, it felt like no big deal, this slice of carrot, and they were like, take a bite. And he said no. And they were like, take a bite. And he swiped at it. And they were like, take a bite. And he disrobed, he urinated on the floor, he gagged, he vomited. And I was told, like, it really sucks to see this. And sometimes it's the only way to kind of prevent a feeding tube or prevent negative health outcomes. And I didn't respond at the time, but I marched back into my advisor's office, Eileen Schwartz, and said, is this the only way? Like, what did we miss? Where was this kid when he was 2? This isn't new. Like, it's not, no kid starts eating just Lucky Charms marshmallows. So something happened. What was it? And she was kind of like, figure that out. There's your doctoral work, which, you can picture this, right? Yeah. And so I've been working with an interdisciplinary team in an inclusive preschool setting at the university to figure it out. And what we've learned is that nobody identifies these concerns until it's really too late. Mm-hmm. It's this wait and see approach of your child's growing fine, their nutrition seems fine. Just kids are picky.
They'll grow out of it.
Yeah, they'll grow out of it. Keep doing what you're doing. And some kids grow out of it, but some kids don't, and we just don't know. So long story short, our approach has really been to shift to this kind of tiered model. It's not, as I said this morning, it's not novel. I didn't come up with this novel model. Like you talked about pyramids yesterday. It's what's our universal approach, and it's a circular model. What are universal strategies? Like who needs to know these things? Pediatricians, behavior analysts, behavior technicians, caregivers, other providers. What do they need to know to present food in a way that is supportive, in a way that allows kids to listen to their bodies instead of like overriding that? Like if we give you a bite, you have to eat it to get removal of the spoon or to get reinforced.
Access to sugary foods.
Yeah, access to a different food. So how can we teach kids autonomy from step one, and then how can we help them comfortably still face discomfort? I'm not saying like kids get to eat whatever they want. Like we can still push and set some boundaries, but how can we do that in a way that's comfortable and intrinsically motivating, so kids aren't learning to eat because somebody's going to reward them, because none of us eat that way. Does that answer your question?
It does.
Yeah, it's incredible.
Thanks.
I'm gonna take us down the path. I don't know if it's the right path to take, but so in that approach, I'm imagining you work with families,
For
how
sure.
to support families, and I'm sure, having been a parent myself of 4, there's some stressful situations when like I made dinner, right? Like I've created, spent time, worked all day. Now I'm here cooking, and you might be in a moment where like you need to support your child to help and make these choices or give these choices. How do you work with families to like work through that stress?
Yeah, that's a great question. It's a big question. So I was mentioning to you earlier that you talked about at Centria the way you talk about client aspirations, and I kind of do similar, where I try to understand what's your vision for an ideal mealtime, because it's going to vary so much from one family to the next, and it's not really my job to decide that your vision should be everybody sits at the table at 6 p.m. and everybody eats the one meal that was prepared. And so I ask, what's your vision? And they say things like, we just want to enjoy mealtime, or I really am worried about nutrition, and we travel a lot, and I want my child to feel comfortable trying something new if that's all that's offered. Or we're dealing with some food insecurity, and sometimes what we have is what we have. So, my vision is that they can eat that because otherwise they can't eat. And then I go to that kind of the baseline of, well, where are we now? Right now, you're cooking a whole meal, and you didn't say this, but maybe 2 of your children are completely refusing it. And so what are the different behaviors, both on the caregiver side and the child side, need to happen to get us closer to that vision? And how do we match strategies with that is kind of the starting point.
I love that. I was just, as you were talking about, I'm like, most parents face this in some way or another, but maybe some don't, but it's like so universal in terms of how we're thinking about food with our kids. And like, because we have our own values and vision of what we think mealtime should look like. And you were talking, and I'm like, man, I have I'm like, yeah, come to my house, please, because I've got one who we're working on just trying the things that are offered, but often makes their own meal. And we have pre-prepared foods that are always available as an opt-in or opt-out. And I have another child who eats literally everything placed in front of them with no problems. And that dichotomy is actually really stressful as a parent, because if 3 out of 4 people in my household are going to eat the regular meal, I'm going to make the regular meal, but then I'm also having to worry about this other meal. And like a vision for me is to only have to make one. But also my value is to meet my kid where they're at and like be respectful of the fact that they have their own unique needs. And so those sometimes compete for me. But I was just thinking about, like, when you're talking about family values, I really appreciate that you said that, because I've worked with a lot of some of the mistakes that I've made is working with families from a different background than me, where like they were perfectly happy to spoon feed they believe in their culture that supporting their child by spoon feeding them and never asking their child to feed themselves is exactly how they want their meal times to go. They don't care if they're standing on the table, they don't care if they're following them around, but their goal was more that like what we're preparing, we would prefer that they eat. Whereas you might have the other dichotomy too. So I just really appreciate that.
Well, it's a balancing act, right? Like I always show a picture of a scale in my slides, where it's like we've got health, safety on one side, and then we've got self-determination or autonomy on the other side. And our job is really to help families find that balance. It's like that age-old Bannerman question, the right to eat. What is it? Too many donuts. And take a nap. Like who gets to decide, and to what extent, and that's going to vary for different families, but we're responsible for asking questions of like what's important to you, and to prioritize that child's well-being, and to help find that balance of like, well, maybe it's okay, for one meal a day, and work with our registered dietitian colleagues, of course. Maybe it's okay for one meal a day for them to have full choice, and then another meal, there's certain things that they can choose from, and just like every family is so unique with that, which makes it challenging and beautiful.
One of the questions I have, which I don't know if it's fully related to our goals of the podcast, but it doesn't matter, because this is just a little bit of conversation, but I'm curious about you're talking about like meeting families where they're at culturally, where their expectations are. And I've certainly worked with families who are like perfectly fine with the diet their child's eating. Like if they have to eat chicken nuggets for the rest of their life with a side of ketchup and that's all they eat, they're like, that's cool. But when you talk about that balancing of health and safety, do you ever work with families to kind of challenge that and talk through the need for maybe nutrition considerations and dietary considerations when they're not really concerned about the restrictive side of the eating?
Absolutely. And ultimately, families get to choose that. So, like, it's this question, too, of if a family has a child with a disability, like, they're making a lot more decisions for their child sometimes than families of children who don't have all these professionals in their ear saying, like, let's try this for the best, in the best interests of the child. So trying to, like, keep that in mind, too, that families ultimately do get to choose. And I almost always refer to a registered dietitian. I wish this were, like, just standard of care that all children get a food log reviewed to add some, dietitians are incredible. I just learned about, because we were talking about anemia, and I just learned that there's like this iron clump that you can boil with pasta and rice, and it infuses iron in it for kids who are low in iron. So like there's ways to increase nutrition that we don't know as behavior analysts, which is why it's so important to think interdisciplinary. But then I will work with families on kind of, that balance.
Well, and ultimately, information is power. And so at the end of the day, if maybe I'm speaking for you, but at the end of the day, what I hear you saying is like, we can inform, we can give those resources, and it's still, now it's an informed choice of how we move forward from this moment, which respects the family's autonomy to choose. Yeah,
exactly.
So in that spirit, what are the resources that you'd suggest the BCBAs that may be watching this podcast, like, dig into?
I've been screaming this wherever I can. Feeding Matters is an organization, a nonprofit organization that focuses on pediatric feeding disorder and avoidant restrictive food intake disorder, both of which are fairly new. They've got interdisciplinary folks working on this, coming up with consensus around definition, the overlap between the two, and they have so many free resources. So if you go to just feedingmatters.org, I believe, I would absolutely start there, and that will kind of direct you to all sorts of different resources. And also, I always tell people, ask your interdisciplinary colleagues and friends, like, what would you look for? What do I need to know to, like, how would I know that a child needs to be seen by you, or that I need to consult with you?
That's a great question.
And you'll learn things like I learned about, like, what kids do with their chins when they swallow if they have a swallowing challenge. And these are little things that can make it within our scope as long as we're asking these questions and knowing, like, okay, I saw a red flag, I need to now refer. Or just like get some consultation and learn a little bit more.
I love that. I imagine that working, like, so you work in a clinic-based setting, right? So you have, I'm imagining, like, employees who are working with these kids in the settings, and then you're generalizing into homes with families. So I imagine that in the consultation, generalization, and working with families, there is an element of stress and anxiety that comes with working through feeding challenges. They wouldn't be asking for the support if it wasn't, somewhat of an EO for them.
Right.
Can you talk about maybe how you support families in, like, their own regulation and, like, diffusing some of that stress, or helping them sit in that space with some intentionality and, like, collaboration, etc.?
One of the first things I do, and this comes from our interdisciplinary work, this was thought of by our special educator, Emily DuPont, but one of the first things that I like to do is do some self-reflection, both as, like, I do it all the time before having a family do it, but having a caregiver go through some questions about their own feeding history, their past, like, what were the cultural traditions? What was good? What are things that they remember that they're like, this was either traumatic or hard? I think you're laughing probably because you are thinking of your meal times as a child. I always have to apologize to my parents when I talk about this, because I'm like, it was really hard, but I had to chew that meat until it was no longer chewable because I had to have an empty plate. That was part of.
And they were doing the best that they could.
Exactly. Everybody, there's no judgment in this, but like, sitting with that and then understanding, okay, what do I want to carry forward with me, with my children, or for providers with children I work with? What are some of my preconceived notions of what mealtime should be? And then what do I want to let go of because it didn't serve me or doesn't bring me closer to that vision? And so just kind of that work of reflection, using some kind of guided questions is always my starting point now, because I think sometimes families just don't even know why they're doing things the way they're doing. I don't half the time.
I love that. It's really on theme.
100%.
We've talked about reflection a lot with all of our guests. Yeah, it's come up like organically every time.
Every
that's
conversation,
awesome.
yeah.
It's so cool. It's so cool.
What's next for you? What do you see, like your interest, work,
Yeah. I want to build capacity in people who eat with kids.
Everybody.
Which is everybody. I want to, I so appreciate getting to be here with you guys having this conversation, because I hear there's a lot of tension just within our field, but also with outside of our field about feeding, of who gets to work on it. And I want people to feel less scared and more empowered and confident in what they can do to support mealtime. So like, we can arrange the environment in a way that's motivating for a child to come to mealtime, right? We know how to do that. We can support families and help them understand what their goals are. We can write goals and take little steps towards them. There's a lot that we can do. And I, like when I dream really big, I'm like, I want every childcare center, I want every preschool, I want every ABA provider to have this basic universal knowledge of this is how we can feed kids or do mealtime with kids in a way that promotes autonomy, learning about our bodies, learning about what food does for our bodies, because I think it'll prevent so much. So that's my dream big. I
love that.
If you were to, man, I'm so excited about this conversation. I just think that a lot of the things you talk about, you have every behavior analyst should hear. And you and I have talked a lot about dissemination efforts, so I'm really excited that we can elevate your voice in this way.
Yeah, thanks.
But if you were to go through we've talked a lot about tier 1, tier 2, tier 3 interventions with feeding, and I would love for our audience to hear your perspective on the tiered intervention of feeding approach that you really have a lot of amazing knowledge about.
Yeah. Okay. So for tier 1, I think by the time we as BCBAs or people in the field of behavior analysis see kids, they're probably needing some tier 2. But in an ideal world, let's say an early learning setting, tier 1 looks like everybody has a basic understanding of feeding kids. What are portion sizes? And this is interdisciplinary. How should kids be sitting, right? This is from our occupational therapists. We learn about this, if you can't see me, I'm this 90-90-90 seating where the ankle has to be at 90 degrees, the knee needs to be at 90 degrees, and the hips need to be at 90 degrees. So we can be supported in our bodies, because so much has to happen to eat. And if we're slumping or wiggling, then eating is difficult. So things like that from all of our colleagues, how do we interpret children's communication at mealtime? How do we observe and see when they're leaning in or leaning back or turning away? Just really simple things, but things that aren't necessarily intuitive to all of us, but they are with our different colleagues in different fields. So general understanding, and then presenting meals at home and in group settings in ways that promotes that intrinsic curiosity and motivation and safety. In our book, we came up with 6 components of fulfilling mealtimes, and I don't remember all of them. Nourishment, inclusion, curiosity, safety.
What's the book called?
Connection. Oh, the book's called Meaningful Mealtimes. It's meant for providers in early learning settings. But yeah, working towards those instead of just focusing on calories and just thinking about is the way I'm doing mealtime right now allowing kids to pause and think about and learn about food and their bodies. And so that's tier 1. Tier 2, if we're doing tier 1 right, then we learn right away kids that need a little bit more, right? We don't have to wait and see, because within 2 weeks of implementing tier 1 supports or child joining our center or whatever it is, we can see that a child is feeling uncomfortable. We can easily see that behavior, and then we can observe it and say, okay, this child needs an additional, we think of it as layers of support. So they're still getting everything in tier 1. They're not being moved to a different level of support. But we're layering on support, alternative seating, alternative utensils. Maybe we're working on increasing motivation a little bit to even be at the table. So that might be environmental arrangements, so the scary foods are not near them, or there's a barrier or something, because we as behavior analysts can do this, right? We can see what's the antecedent, what's triggering this behavior, and we can change it.
And we're really good at shaping.
So it doesn't, I always tell people, it doesn't have to be forever, but like we're making this motivating first. And then again, we can see right away if those adaptations, those modifications aren't enough, and then we can either refer out to those programs that are more intensive, or we can bring someone in, which is the dream, but I don't know about feasibility, bring in the like registered dietitian and say, can we look at this? Like, can you look at a food log, or refer them to an RD that can then help us kind of plan for that next level of intervention. So everybody's kind of getting support where they need it, including people who don't have feeding challenges but can learn about food and nourishing their bodies in a way that will go into adulthood.
One thing I want to make sure that our listeners hear, which is like I want to just get a little bit of clarity, which is you talk about making things motivating at the table, like creating a motivating environment. It's maybe a pointed question, but like, does that include Skittles? Does that include those preferred, like, like, do the thing you don't like and get the preferred food item that you do like? Can you talk a little bit about that?
Yeah, thank you for asking that. So no, it doesn't. And I feel pretty strongly about this, although I will also say that I'm like a never say never kind of person. Like, if you give me a good case with like that you've done all the ethical decision making, and this is like, I mean, it would have to be pretty severe for me to be like, okay, that makes sense. But I think as in general, as like in universal supports in tier 2, we as just general BCBAs in this work should not be doing that. And I always have people think about, like, if you too would do this, like, think about a food that you absolutely like are disgusted by. Like, what's something you don't want to eat ever?
Spicy food. I eat like everything.
Spicy food?
Yeah, I don't like spicy food at all.
Okay.
Cooked fish that's like strong and like fishy taste.
Okay, yeah,
like,
I can see that.
That's a good one. I'll go with that too.
Yeah.
Easier,
Okay.
because I will never eat spicy food.
Okay.
There's nothing.
But does it disgust you, or do you?
No,
just
I have an allergic, like a histamine reaction to
Okay.
it.
If you think about something that like disgusts you, so like the idea of like really fishy fish, is, that's probably universal. So if you think about this, but like imagine the fishy fish in front of you. That's going to be how we describe this now. And I'm like, okay, Timothy, if I, like, how much could I pay you to take a bite of the fishy fish? Do you have $100? $100. Okay.
Yeah.
So I'm like, okay, Hillary, take a bite, and then you get $100. Do you take a bite, you get the $100. Are you like, the next time I present the fish, are you like, ooh, yum, like, now I like fish? No. If I pay you $100 every time you eat it for 3 weeks, are you going to like the fish?
After that $100 is gone, I'm not doing it anymore.
So like this fish is like, when we're like, it's just a banana, it's just an apple slice, like, it's that fish. They're feeling disgusted, and now they're like, okay, well, I only get my reinforcement if I do this thing that my body is telling me, like, biologically, physiologically telling me, no, this is disgusting. I asked this morning in my talk, and somebody said liver, and then like 3 people in the audience had this like big reaction of disgust, because it's an actual physical reaction. Like our stomach does things, our brain, like our mouth reacts.
I'm
right?
salivating right now.
It's just, like things happen, and so that's happening. And reinforcement for bites could teach a kid to like eat for nourishment, but it's never going to translate to intrinsic motivation. So if we're only thinking about like what's going to transfer to intrinsic motivation, it's a lot, we can better promote that autonomy. So for example, if a child really likes sensory play and they're really worried about new foods, I might include some sensory components at the table without any pressure to eat, because I want to say, it's dinner time, and I want the kid to come running over and like want to be there, want to explore for that intrinsic motivation, not because like, mom's going to give me a cookie, or my teacher is going to not let me go to my favorite book area,
or I get to
whatever.
escape when it's over.
Yeah, or not because I get to escape when it's over. So like, yeah, we get really beautiful graphs for that, from that kind of very publishable graphs from that kind of work, but we're not asking those like about those qualitative measures of like, were they okay? Did they like it? Did they want to do it? And I think we need to be picturing these kids as like 30-year-olds who we want to go out to eat with their friends, or to eat at a birthday party or a cultural celebration.
It makes me think, just real quick.
No, go ahead.
Dr. Carly Eby is a friend of mine, and her dissertation looked at, it's going to be analogous, but her dissertation looked at the tact. Under what conditions does someone tact more or less? And she compared giving tokens for people talking versus just like praise and attention for people talking, and showed that like under the right conditions, like that conditioned reinforcer of like tacting came about. Seems very similar to the idea of like how you arrange motivations to align with the actual motivations that exist versus like some like prosthetic reinforcement that's like maybe props it up.
Yeah.
I love the idea of the 30, yes, and like you think about someone at 30 years old, if we've created this relationship with food where you only get the good stuff when you do the bad stuff, when you're 30, no one's gonna make you do that, and no one can, right? So then what are you most likely to choose? What kind of relationship have you developed with food? Like, because I typically see in feeding like interventions in our field, like overall is like, eat this and then get a Skittle. Eat this and have this thing, you not necessarily, whether it's like, whatever kind of reinforcer it is, generally it's an edible reinforcer, right? You get an edible reinforcer that you prefer for eating the edible reinforcer you don't, or the edible that you don't like. And I question for people often, like, what kind of relationship are we making with food in this instance? Like, are we increasing the MO to want the food that we are trying to get them to eat, like eat differently from, or increasing the motivation to try the foods that they're a little bit nervous about? And when you think about that, and you think about someone turning 18, 21, whatever, and we now are moving into a group home where they do not restrict access, they cannot restrict access, what kind of life are we setting someone up to have with, what kind of relationship are we setting up with food? Having been someone who's had a pretty storied history with eating, I wrestled and I had to cut weight a lot, and there was no regulations around how much they could ask you to purge yourself to lose weight. It created some really unhealthy relationships for me with food around like increasing the propensity of motivation to eat the foods I was not supposed to eat. And so when it comes down to a moment in time where I'm like feeling an urge to like have a desire of eating fulfilled, I'm more likely to go towards sugary things that give me that quick, like it just hits an endorphin in a different way, because that relationship was established from a very young age for me.
That's a great example. Thanks for sharing that.
Yeah, and I think like if we were to sit back and think about that, like what behaviors are we adding motivation for versus like you're saying, creating a context that almost creates a different relationship with food too.
Yeah. And here's another example of like where reinforcement, like I still love it. I still love the idea of motivation and how to set up reinforcement and thinking about reinforcement schedules and everything. So another example of how we might use it is helping kids push through some discomfort, but without it being about consumption. So I refer to it as the conditional diet, where it's like, does this child eat chicken? Yes, but there's all these conditions. It has to be nugget form, it has to be dinosaur shaped, it has to be with ketchup, it has to be air fried, it has to be at a certain temperature, etc. Right? And so we can't present like a banana or a strawberry because we can't even like change anything, but we can work within those conditions. Like, and again, it doesn't have to be around consumption, but it can be around like making change fun and intrinsically motivating. So I might, or another example is like I might take a piece of cheese that a child really likes, and they like stars or like space, and I might take a star cookie cutter and make some stars out of the cheese, and then I can use my reinforcement strategies, whatever it is, like a token, whatever works for that child, I mean, without getting too specific here, and cut the stars, child eats the food. We're not reinforcing the eating of any amount, but we can say, hey, you did something new. Hey, we practiced flexibility, and then the child's learning, this is fun.
It's okay for things to be different.
Yeah, this is fun. I'm uncomfortable with flexibility, but then not this kind. Like I was okay, and then we can shape because we're good at that. And none of it ever comes down to like you ate this slice of cheese. It's all about like you did something new. That's doing something new can be hard for us. We're validating that, and you did it. So I'm not like, I think sometimes people push back on my philosophy, thinking like I'm like, if a child says they're anxious, like we're hands off. Like, okay, fine, you can just eat your Lucky Charms and cheese. No, we still can work on it, but we can work on it in a way that's internally motivating for a child.
It teaches resiliency.
Yeah,
which
like
is where we can be really good at that.
Yeah.
One thing that keeps coming up, I've been wanting to ask, and I think this is a great time to ask it, which is we do have a lot of our own biases and cultural perspectives on food when we come. Like, I have a different perspective than Timothy has, than you have, and it sounds as though you do challenge the status quo for people, like in general, like the way you're talking about things. Like, I can imagine for staff or for families, there's some discomfort in the ways that, like, maybe for I don't know, I'm just going to talk about it from the experiences I've had, is like if a technician were to be like, well, they need to eat the cheese, right? But we've told them they need to eat the cheese and that's what's best for them. And like, they're bringing in their own perspective, which is valuable, and their own learning history and like their own previous mealtime experiences to be like, yeah, but the stars don't really matter because they're not eating the cheese. And so how do you navigate that with families it's a hard time to shift that perspective to what you're talking about?
Well, first of all, if you do it the way that I've been describing, I've never had them not eat the stars of cheese. You know, like they're like, "Ooh, cool! The same cheese I love is now a star." So eventually we get there,
but not right away.
Not right away. And this is where I come back to that vision, that like first vision. Like, if I had a magic wand and your next mealtime is your ideal mealtime, what does that look like? And then we go back to baseline and like can make a time, and I do this, like I make a timeline of like, this is a longer path to that vision. Here's how it's adding. Like, here's why this little behavior change is going to lead to the next behavior change and the next behavior change. And always asking the question, like, is this strategy moving us closer to our vision or further away? And if it's closer, then I haven't had a lot of pushback from families because it feels good for them.
Yeah. I love that.
And they don't have to be, the other interesting thing is that, like I did this in my dissertation study, worked with family coaching, is their fidelity doesn't actually have to be that high. Like, it's very much like, can you do this once a week? What feels good for you? Like, what works with your family? I'm never like, every dinner you have to present one new change, because sometimes they're coming home from work and they're like, I can't do anything at dinner. Yeah. And so now I stress to families, like, you don't have to do it perfectly. You do it however works, because my outcome measures are about their quality of life, not about consumption. So it's nice to like give them that kind of like validation that it's okay to go slow.
It's very human.
Mm-hmm. Yeah.
So we're on the HRE podcast, and we ask every guest this: what makes you happy, relaxed, and engaged?
Oh my gosh, I wish I was prepared for this. Well, it makes me...
You could have multiple contexts.
Like, okay, well, I'm thinking about work first, and like getting to have conversations like this with people that support different thinking is one thing that makes me relaxed and engaged and happy too. But just like connection, being with my family, being with my children, sharing activities that we all enjoy. My children are now old enough that like it's not just about taking them to things that they want to do and I watch them, which was fun, but like we can like enjoy the same shows and same activities, and that I think is family-wise my HRE.
I love that.
This has been a great conversation.
Very great conversation.
Thank you guys.
Thank you so much.
Yeah.
I love having you here.
Me too.
Let's do this again.
Please.
What a great conversation with Yev.
She's amazing.
Right?
I'm so glad you got the chance to spend some time with her.
Oh, man. Like, what's interesting, and like, it's maybe just from who we've selected, but there's just been this commonality across.
It's been wild.
Every single one of them.
And we haven't let it there.
No. A genuine, curious spirit, a genuine, like open and and just remarkable in like her approaches, like in addressing an area that like is much needed, but like not being addressed.
Correct. Her focus on like a tier 1 model.
Yeah.
It's where she really, like, that's how her and I, it's not really how we started connecting. We connected in other ways, but that's how we started like clinically connecting. The way that she like sets up this idea of tier 1 intervention is something I had never really thought of or heard about for feeding. Mm-hmm. And I remember really early on her sharing with me like some of the ways she was teaching her own children to like engage with food before she had her even had her dissertation completed, before she had her book. And it was so inspiring for me. It like actually changed for me how I was approaching mealtime with my kids, and specifically one of my children, to be more of a tier 1 intervention, because I was coming and had previously been coming at feeding with this kind of, I wouldn't say it was extinction-based, but it was like not the appropriate relationship I was trying to build with my clients or my children. And I think the way she talks about like, this is something you're way better at technically talking about than I am, but like that reinforcing context. Yeah. And like how we create like an environment that is generatively generative learning environment, which is like something you'll nerd out about all day. I don't know, it's just a unique perspective, and I love it.
And it just aligns, you know, we think about like what we're trying to do at Centria and how you have a limited set of resources to support. Mm-hmm. You're hiring a number of BCBAs who are coming in with, you know, some good experience, but necessarily like all the experiences they need to,
or should they?
Right, to work with all the clients that we have. And so as an organization, what I love about this idea of a tier 1 approach, which is like, so what are the things that we can just like program into the environments in which like we support all of our clients, and we know from the foundational plan that like that as an approach can address a lot of the needs 80%. Of a lot of our clients, and just being more thoughtful about those areas in addressing like skills and behaviors that are of significant concern to the majority of families that we work with.
I agree. It actually makes me think about like I think schools have really tried to do this to some extent and with some success, but like a universal tier 1 system. Yeah. And like we as a field I don't know of anyone thinking like who has talked about, and maybe those people exist in ABA organizations of like, this is our universal tier 1, this is our universal tier 2, and we're kind of emerging in that way with like the foundational plan, PFA, SBT, risk, acuity, things we haven't talked about on this podcast this season. But now I was thinking when she was talking, I was thinking about like a comprehensive tier 1 intervention is not just, is our environment set up to be successful for learning and for like assent, but and are we teaching the right things in the right ways in the right sequence aligned to family prioritized aspirations, but are we looking at this whole human being? Are we thinking about their quality of life with food? Are we thinking about their quality of life with how they're going to navigate like eating as a social context? And we're working with our clients that we want to have generally more comprehensive opportunities socially. Yeah. And so like thinking of the tier 1 component of feeding, it also makes me think about like honestly health and safety with sexual activity, which is something we've talked about before of like, there's probably a tier 1 for like sex education for our populations that's completely missing. And so if we think about our current approach of tier 1 and thinking about the comprehensive expansion of that, I think goes to your point of being more thoughtful, it's really like the outcomes we're looking for, because it's about quality of life. Yeah, and agreed. And I think, you know, one of the shifts in my thinking about this is like, we remain the rigor of like being individualized to our clients' needs, but as an organization that has a lot of environments that we have a lot of control over, we just need to be a lot more thoughtful in like how we set up those environments to support learning in all the areas that our clients need to learn and the goals that they have. And how. Yep. Right. I know of many well-intentioned supervising clinicians at our organization who target feeding. Yeah. Right. And very often it comes up in the consultative work my team does around interfering behaviors, lack of progress, and like needs that people are asking us to solve. It's like we are missing this fundamental concept of the how. Yeah. And we're getting there in other areas. This is just a blind spot that I'm excited about what she shared, because it opens a possibility that I hadn't really thought about before. Agreed. And it also leads into some of the other conversations we've had around the thoughtfulness and direct considerations over those environments and contexts for our staff. And I think Yev did a nice job talking about that with families. And she was the only one that we talked to. Well, not the only one, but we went on a lot more in depth around families with her. And what a gift for people to hear
100%.
how she approaches things.
That's one thing I've just loved about this season, and is that like each one of these people have like challenged us in a way to like rethink what we're doing and how we can improve what we're doing at Centria.
I've never felt dumber.
Yeah, and more inspired.
Yeah. It's honestly been a minute since I've felt like so invigorated and motivated to like dig in new ways. And it's like, what a privilege to have gotten that, like the opportunity to talk to all of our guests where I'm like, wow, I'm learning so much right now. And like, I'm also not learning enough and I can't wait to learn more.
Agreed.
Yeah.
Great episode.
That was a great episode.
Yeah.
And that concludes another episode of the HRE Podcast.
Thanks for listening. If the HRE Podcast is a part of your synthesized reinforcers, let us know what else would make the perfect reinforcement context for you in the comments below, and join us next time.